Hi, my name's Safeena Kherani. I'm a pediatric ear, nose, and throat surgeon with Dubai Health. I have a keen interest in air quality as it relates to the health, particularly of children. Here, we look at individuals who might be more vulnerable, such as those who might have asthma or complex aerodigestive issues. In terms of air pollution, it has had a huge global impact in terms of burden of disease. We know that it's associated with mortality, it can reduce healthy years living, but in fact, it's now on par with other major health risks such as unhealthy eating and obesity, and even cigarette smoking. The World Health Organization has named it the #1 environmental threat to health. Again, why does this happen? Well, when you breathe air in, it comes in through your nose and your mouth, through your trachea and into your chest. What some people may not realize is in addition to those pollutants, particles, depositing in different parts of the aerodigestive pathway, it actually can transfer into your blood system as well. So it's not surprising that children with asthma have exacerbations in their asthma. In fact, there's data that shows living near a road that has an abundance of traffic can actually almost trigger asthma diagnoses. We can also see that it's associated with absenteeism from school, increased visits to the hospital, but also it has an impact during exposure during pregnancy. We know it has lifelong impact in terms of cognitive development. And so the question begs, what are we going to do about it? Certainly, the global burden of disease from air pollution has been well studied at a population level. But if we take a look at it at an individual level, there are studies to support this as well. So for example, one might ask the question, does an individual who have allergies and asthma and nasal symptoms have more symptoms when they're exposed to poor air quality? We did a study here a few years ago looking at a 10-year-old young boy who wore a portable air quality monitor, looking at nitrous oxides, particulate matter that was less than 2.5 microns, less than 10 microns, and volatile organic compounds. And it was striking that with every peak in these pollutants, he had a concomitant increase in his subjective symptoms and even on an objective questionnaire. So what this means is that not just at the population level, but at the individual level, air quality has a true impact on the person. If we do improve the air quality for children, does it make a difference? And certainly it does. The evidence does support this. There are wonderful studies out of New Zealand and Australia that showed with improved filtration and air quality, whether it's at home or at school, children had improved lung capacity, improved activity level, and more ability, obviously, to learn. And isn't that what it's all about? Children being able to have the chance to just be a child and have fun.